The anatomy of the liver while it is very complicated, I like to simplify it into two forms and say that there's basically liver cells and bile duct cells. And the liver cells produce the bile. The bile is excreted into these small channels, and these small channels will then start to get larger and larger and produce the bile ducts. And during meals, the gallbladder will contract and then will excrete or expel a lot of the bile into the digestive system, which allows us to proceed and have a normal digestion and absorption of vitamins.
So liver cancer often happens in the setting of people having underlying liver injury. So some people who have known problems with their liver, whether it's hepatitis B or hepatitis C or history of alcohol use, may be followed closely because of their risk factor for liver cancer by their primary doctor or a hepatologist, a liver doctor. And in some people, surveillance or screening with an ultrasound or a CAT scan might or even a blood test might help to detect liver cancer at relatively early stages. And so that really depends on whether you're known to have a primary risk factor for liver cancer, such as hepatitis or such as history of a lot of alcohol or other injury to your liver. Other times, if people aren't known to have any underlying liver disease and it's something that's caught out of the blue, a tumor might be discovered based on symptoms such as pain or sometimes blockage causing yellow eyes or dark urine or itchy skin, some bloating, or occasionally symptoms of a lot of pressure in the liver, which can be bleeding in the abdomen, which can be very sudden and severe abdominal pain or bloating, or even throwing up blood, which can happen when the pressure in the liver causes dilated blood vessels in the stomach or esophagus to burst. That's obviously a very dramatic and potentially life-threatening way to get diagnosed with the cancer, but it does happen sometimes. The range of treatment options for the liver cancer are impacted not only by the size and location of a liver tumor, but also by the health of the rest of your liver. And so if it's a very small tumor, just in one part of the liver, we first think, is this something that we could have removed by surgery? And that often depends on exactly where in the liver the tumor is. Is it in a location that's safe to be removed? As well as how healthy is the rest of the liver? Is it healthy enough to take out a chunk of liver around the tumor and not go into liver failure? And for people who have no problems with their liver, no hepatitis, no cirrhosis, often sometimes up to 2/3 of the liver can be safely removed, and the rest of the liver will grow back healthily, generally within 3 months, and regenerate, which is a very unique property of the liver. Most organs don't do that. No other organ does that. However, if people have a damaged or diseased liver because of hepatitis or prior injury to the liver, such as cirrhosis, it's not safe to take out that much of the liver, and it may not be safe to take out any of the liver. And in those cases, surgery may not be an option. If the tumor is very small and people are otherwise in good health, we actually know now that liver transplant can be as effective as surgery for people who have a liver that's not healthy enough to have a surgery. And so people can be evaluated for liver transplantation and eventually undergo liver transplant for small or early stage liver cancers. It can be very difficult to decide when to switch from standard treatments like arterial therapies, where we put chemotherapy or beads directly into the tumor, versus switching over to what we call systemic therapy or chemotherapy to the whole body. And it really is a judgment call that weighs a lot of factors, including how healthy is the liver, how have the tumors been responding to the prior treatment. If they're all doing really well and each time it seems to work, then we might continue that treatment. If we see it's not working as well, or if there are side effects, or if we think that there are too many tumors to keep doing that successfully for the long run, that's when we start thinking of switching over to chemotherapy. And again, because the options are currently limited, we try to think every step of the way, every time we start a chemotherapy, from first line to second line to hopefully many lines if we can keep the cancer under control, we look and see what the new options are, because this is a cancer with a lot of growth right now, a lot of momentum based on the unfortunate fact that it's a growing cancer with a huge global population, the bright side of that difficult fact is that there's a lot of interest in making progress and a lot of research going on, and so we do have a lot of new drugs and new agents that seem to be showing promise, and so every step of the way we look for something new and better to try, versus some of the tried and true standard treatments, which can be quite helpful too.